Hi, I'm Dr. Dane Happany, physical therapist at Healing Motion Physical Therapy, and I'm going to talk to you about how to self-assess if you potentially have tennis elbow or golfer's elbow. So tennis elbow is classically just outside elbow pain. You have your common wrist extensor and finger extensor muscles that attach what's called your lateral epicondyle, and you would have pain here typically with activities of gripping and using your hand. So the easiest way to test is first, do you have pain in that location? And then basically if you contract it, stretch it, and when you touch there if it hurts, then it's pretty obvious you have it. Not a bad idea to see your local physical therapist to have that confirmed, or if it's a more serious issue, seeing your physician. So for tennis elbow, our wrist extensors extend our wrist up or our fingers up. So what you want to do is just extend up, and sometimes that hurts right there. So probably that tennis elbow, or what we would call lateral epicondylitis or epicondylalgia. And so if you need a little more oomph, you load it up and then you resist and you don't let yourself move. And again, if that hurts, it's positive. The other thing you can do is make a fist and come down and stretch with your elbow straight and see if that reproduces your pain. That's usually the least common. And then lastly, just touching in through there, in through your elbow to reproduce. If so, you likely have that tennis elbow or that lateral epicondylitis or epicondylalgia or osis, and go ahead and check out our self-massage and then also our strengthening videos, which is huge for that. For golfer's elbow then, you're going inside elbow. So that's more gripping, flexing this way. And so for that golfer's elbow, it would be pain more on the inside of the elbow right here. That's where your wrist flexors and your finger flexors attach at that medial epicondyle. So this would also be medial epicondylitis or epicondylalgia. So with that, you're gonna simply flex your wrist up. Again, sometimes that hurts. If not, resist and try not to let it go down. And if that hurts you, again, that is likely your diagnosis. You can also stretch with that hand wide open and coming through here to stretch. Least likely to reproduce your symptoms, but it could. And then lastly, just touching through there. If that reproduces right along that elbow bump or kind of into the front of the forearm, then you'd be positive for that. So if you're positive for that, or you want to avoid that, then take a look at our self-massage and mobility resources, as well as our strengthening resources to improve.